Welcome to Fit Fun Abs. We're speaking with Cat Govan from Alcohol and Drugs Action on International Overdose Awareness Day. Hello, thanks for joining us. If you're happy enough, if you introduce yourself and just mention what you do and your experience.
Thanks very much for inviting me today. My name is Cat Govan. I am one of the service managers at Alcohol and Drugs Action, also known as ADA.
Thanks very much for coming on. Appreciate it. It's been quite busy. So firstly, we're going to look at ADA and just a brief look at how it stands today with the current climate.
Yeah, I mean, ADA, for those of you that don't know, has been in existence since 1986. Previously called Drugs Action. I think, again, our focus and probably what we're known for is very much around our needle exchange and our harm reduction approaches that we use way back. If you think of the climate in 1986, it was very much around HIV and around solvent use. And I guess if you fast forward to today, Alcohol and Drugs Action, I guess, really reflects that we support people who use both drugs and alcohol. And we have a whole range of services, both from a harm reduction approach, but also more of a recovery focused approach as well. I guess we really work with people where they're at. So if people are wanting to use the drugs or alcohol that they're using more safely, we're happy to work around that. If it is more of an absence-based or a recovery-focused approach, then we can certainly work with people as well around that. So it's really working with people where they're at and what they want to achieve in their recovery.
And also, I know there's quite a lot you can do for families as well.
Yep. So we also have a range of children and families services. They work with young people, children, families, both about the impact of their own use. So from a parent's point of view, it could be the impact that substance use is potentially having on the rest of the family. From a young person's point of view, it could be the impact of their own substance use on themselves, but equally the impact of somebody else's substance use on the family. So we have, for example, a family and friends support group where loved ones of people who are using substances can get support, and also support for young people about the impact of parental or carers' substance use. So yeah, we have a range of services. I should have said that we have both one-to-one support. We provide one-to-one support, but we also have a range of groups, and that includes volunteering opportunities and a range of different therapeutic groups, such as gardening groups, craft groups, and DART, which is one of our own. A group that ADA have developed to basically increase recovery capital, I guess, and help people in their recovery journey. So yeah, it's really trying to cater for people where they're at and what they want to achieve in their substance use and their recovery.
Thanks for letting us know that. And I can relate to that. Obviously, it was the NX that it sowed the seeds for me. Just no pressure, just always that offer to attend upstairs, which unfortunately I didn't do straight away until rock bottom. But that seed had been planted, and that's what brought me to ADA, thankfully. And this great for the last 4 years. So I thoroughly appreciate that. With COVID, there are also groups online as well, aren't there?
I guess in the last year and a half, like everybody, we really had to adapt our service provision. Obviously, in the initial lockdown, we were working from home. Certainly the recovery services that I manage, our staff were predominantly working from home, doing a lot of phone contacts, online contact for one-to-one support. Obviously where clients needed, high risk clients, people who needed that face-to-face support, we were doing things such as kind of doorstep checks on folk, and also doing home visits. Our needle exchange, thankfully, has been able to operate throughout COVID. We've had both our base in Haddon Street open, but we've also developed a sharp response service, which basically delivers needle exchange equipment to people's doors. And obviously then we could do some of those doorstep checks and just welfare checks, see how people were, but also deliver food parcels. We got additional funding for mobile phones again to try and help people to stay connected, not only to services, but equally to family and friends as well. So over the different restrictions that we've had, you know, we've really had to adapt our service provision. We've been able to see people for walks and talks and out and about when the restrictions have enabled us to. But I think that certainly going forward, it's probably not throwing all that learning out of the window. It's kind of looking at a bit of that hybrid model moving forward of what's the best way for people to engage? Is it by phone? Is it face-to-face? Is it a bit of a mix of both? So, you know, really looking at delivering that going forward, a bit of that hybrid model. Because again, some of that learning that we had, particularly in that first lockdown, is engagement was actually really, really high. People were picking up their phones, were talking, probably because there wasn't really much else that you could be doing at that time. So I think it's, as I say, it's not losing that learning, both from a face-to-face, but also from a group work point of view as well. Obviously, a lot of our groups went online at the beginning, just starting to open those up again to be face-to-face, but also having that option of having some people face-to-face in the room, but maybe a big screen and people still being able to access that group online, because I appreciate not everybody is kind of ready to come back out and be in a room with other people, you know, and ready to do that yet. So it's again just really trying to be flexible, adaptable, but also provide options for people to access support in the best way that they can.
Well, that's incredible. I think having so many options open means there truly is something for everyone. International Overdose Awareness Day. I wondered if you'd like to maybe mention what the importance of the day is.
I think it's a really important day. I think it's about challenging that stigma and, you know, hopefully trying to get support. I think, as you've just said, trying to offer support to as many people as we can. You know, we've got a number of campaigns on our social media today in particular, but all the year round around naloxone and Nixoid provision. So anybody can come forward and get some training around overdose awareness. So what are the signs of somebody having an overdose? And also being able to get a supply of naloxone so that they can confidently be able to provide that to somebody if they come across somebody who they think have had an overdose. And I guess it is just, again, raising that profile of, you know, it buys you that time and actually buys people time to be able to go and phone the ambulance or get that medical help. I think, as you'll see on our Facebook page today for ADA, there's lots of examples where staff in particular have, you know, either had to implement naloxone. I know a member of staff, I think it's on our Facebook page today, literally was walking into work and found somebody just around the corner from our front entrance who was unconscious in the street, and we were able to administer naloxone and call an ambulance. So I think more and more we are realizing that it's a life-saving kit that you can have in your bag and is able to buy that time and save somebody's life. So I think the day is really important, particularly in light of the drug-related death figures that have recently come out. You know, and it's again about, I say it's the little things you can do. Obviously, it's a massive thing you can do is to buy somebody time until that medical support comes. But it's again a way that you can help other people and family members who potentially are going to overdose using an opiate, and you've got that life-saving kit in your bag. It's really important.
For sure, every life matters, and I think it's breaking down that stigma, isn't it? And encouraging people, if they've done the naloxone, to carry that naloxone. Yeah. And so I just think it's fantastic. And I think Marshall College is going to be doing something.
Yes, it's I think it's going to be lit up purple, which is the colour for International Overdose Awareness Day. So I think there's going to be some event. I think staff and family members, certainly, and community members will be at Marshall College this evening. I think it's between 8 and 9. So again, just a great way of raising the profile of the day amongst not just drug and alcohol using population, but the community, the whole of Aberdeen. I guess it is trying to raise that profile as high as we can.
That's fantastic that everyone's coming together like that. I know there always seems to be and rightly so, an emphasis on the drug-related deaths, the overdoses rising. But I think also we need to consider how much work's going on and how much higher those figures could have been had all this work not been done these past few years
Sure.
with naloxone and so much more. So there's countless lives which have been saved. So
Definitely.
regarding ADA, obviously it's International Overdose Awareness Day today. But for moving forwards, is there any milestones or projects coming up?
I think for me, the key bit is really to see what the new normal is going to look like, and again, how we can adapt our service provision to continue providing support to as many people as we can. So a big focus for the organisation at the moment is opening services face-to-face back up again. As I said, our needle exchange has been open throughout the last year, and our helpline's been available, and clients that are open to us as open cases, obviously we've maintained contact. But one bit that we haven't been able to open up yet is our duty system. So again, people can literally just walk in off the street without an appointment to come and get support when they are ready to access that support. And I think that's really important. That service is open 7 days a week. So I think there's nothing more courageous than coming across our front door and asking for help. And I think there can be nothing worse than that service not being available at the moment, although there's other ways to access obviously support just now. So I think a key milestone coming up, certainly for our direct access harm reduction service, is that duty will open up again in October. We are certainly moving towards more face-to-face appointments with clients, and just again being able to offer that choice for people of, do you want a phone call, do you want a WhatsApp video call, do you want to come in and see face-to-face, either within ADA or out within the community. I think that's going to be a real key milestone of just again offering that choice for people to access support. We have, and we're involved with a number of young people's services in the city as well, just accessing or providing support for young people, both around their own substance use, but also around kind of the impact of someone else's substance use on that young person. And I guess that's probably an element of the service that I'm really passionate about, is about that early intervention and prevention, and trying to get in that early and prevent the substance use becoming really problematic. So that's a really exciting project to be part of the hubs within Aberdeen City at the moment. But yeah, I think again, our group work is starting to open up again and become more face-to-face, which again provides people more opportunities to meet other people in recovery and share experiences, and that peer support I think is really key. Our volunteering services are still taking on, and have over the last year taken on, new volunteers and provided training. So yeah, so it's kind of service as usual. It's just maybe adapting how we're providing that service, depending on the restrictions, unfortunately, that we're under at the time.
Yeah, thanks for that, Kat. I think we're all going sort of trying to work out what the new normal is going to be, but it's incredible that things are going on like that. You mentioned community hubs. Is there certain places in Aberdeen that are open just now?
For the outreach for our direct access service, yeah, we're certainly back out in communities. There's more information on our Facebook page and our website for details of opening times. But yeah, again, just trying to be where people are at, you know, and trying to reduce as many barriers as we can for people to access service is the key to what we're doing.
For yourself, is there anything else you'd like to bring up or mention?
I feel like I've talked lots and very quickly. I apologize.
No, that's no problem at all.
I think it's quite difficult because in some ways, you know, a lot of our services have been provided over the, you know, over the course. It wasn't like we kind of closed. It's just that we've adapted services depending on kind of what we were able to provide. And I guess really quite proud of the way the staff have adapted to be able to provide that support and also deal with working from home and potentially homeschooling and everything else that kind of everyone else was dealing with in lockdown. But yeah, just really quite proud of the staff and how they've adapted to continue providing support, not only to the clients that they're working with, but also to each other. And you know, I think it's been quite tough for particularly the services I manage of our recovery services and our children and family services. They have been working from home a lot of the time, and it's again trying to maintain that connectivity between team as well as has been a real key aspect of the last 18 months.
For sure. And you've mentioned obviously volunteers that are coming along and joining. Is it a big, you know, is there a lot of hoops to jump through to become a volunteer? If I wanted to become a volunteer, how would I go about it?
Yeah, there's again information on our website, and we also have a volunteer coordinator, Anne McAllister, who basically you send in an application form or put in a note of interest basically to say that you would like to become a volunteer. We have a recruitment process which Anne will talk you through. It's not arduous. We do ask for PVGs for all our volunteers. But again, if you do have something that maybe will come up on your PVG check, chat through with Anne. It is not necessarily going to prevent you from becoming a volunteer. It might just mean only certain volunteering opportunities are available for you, but it certainly won't prevent people from becoming volunteers. There is then quite a very good training program that all our new volunteers go through. And again, that will be quite role specific depending on the role that you have as a volunteer. So we have volunteers who, for example, may staff an information stall, say at RGU Freshers Fair or at Nestcoll's Freshers Fair. We have volunteers who facilitate groups. We have volunteers who are befrienders, and we have a telephone befriending service. We have volunteers who go out and provide naloxone training in their own communities and for other services. So there's a really varied roles for volunteers to have within the organisations. And again, our volunteers are really varied as well. So we have people with living experience. We have family members who are volunteers with us. We also have people who have nothing, you know, have had no experience of substance use who come and volunteer with us. So yeah, there really is lots of different roles you can take as a volunteer, and you know, lots of different people come and volunteer with us. So yeah, Anne's a great first port of call for anyone who's interested in volunteering with us.
Okay, thanks for that, Kat. Well, we'll put some links on the video as well for the ADA and for Anne, etc. That's incredible. I suppose the only last thing perhaps people have put aside with COVID and other things is things like the DBV testing and things like that. Is that important to keep on top of that? Should people come in and or request tests?
Yeah, definitely. I think so bloodborne virus testing can test for things like hepatitis and HIV. You know, we have pre kind of COVID, we had really good links with NHS. So we actually had a nurse who came into our needle exchange. So again, a bit of a one-stop shop where people could not only be tested, but also receive their Hep B vaccination, and also look at things like Hep C treatment, HIV treatment, and link into places where they could get that. So yeah, I think it's really key. I know there is hope that, for example, Hep C will be eradicated. You know, so again, I think the key part for me is getting the DBST test, which again we can now send out to people as part of that sharp response. People can self-administer the tests. I'm hoping as our services open up again, we can get people in to do BBV testing as well. But I guess the key bit is, even if you've had a test in the past, come and get tested again and see what your status is. And then we can get a bit of a treatment plan or a plan around that together with you and link you into the most appropriate services that can help.
That's incredible. I think things have changed so much. It's such a quick and easy test now, as opposed to what it was before, isn't it?
Yeah, I think the test is really simple. It's literally a kind of pinprick on your finger and some dots of blood onto a card. But equally, I think a lot of the treatment, particularly Hep C treatment, is a lot, I wouldn't say easier, but I think it's less complicated and shorter term than it has been in the past. So yeah, even if you found out about it in the past and you weren't keen to undertake that in the past, I would really recommend you come in and speak to a worker, get the test, get an updated status, and then we can discuss various options for you from there.
Finally, for yourself, well, what's on the cards for you in the next few months? Anything coming up?
I think it's settling staff back into a rota of being in the office again and just getting used to being out and about again a little bit. We are starting up a project that was put on hold in Aberdeenshire that is specifically around young people, really innovative multi-agency work funded through the Cora Foundation. So it's a three-tiered approach to really trying to change young people's substance use and patterns of substance use. And I guess for me, that focus again really on mental health and well-being. So that'll be great to get back up and running again. And also looking at how we work in partnership with the Substance Misuse Service. There's pilots of new ways of working, such as shared care, which is really exciting, and I think will actually be a lot more tailored to what clients need rather than kind of what services, clients fitting around services rather than the other way around, which it should be. So yeah, there's some really exciting new ways of working. I think that's the key bit for me. I think although COVID, I think, has been really challenging, it has actually been a great opportunity to look at different ways of working and working more effectively. So hopefully the learning that we've had in the last year and a half, we can continue and develop further going forwards.
It's great to hear there's something positive coming out of COVID, and incredible that things have gone on so well for ADA. And into the future. And if you have any last messages, perhaps for someone that's thinking about reaching out or wanting to reach out.
Yeah, I think I would just say, I know it can be really scary. There's lots of different ways you can get in touch with us. You don't have to rock up and come and kind of present face to face. I think that can be doubly scary. So again, we have helpline available 7 days a week. I would just really encourage you to pick the phone up, either if it's around your own substance use or somebody else's substance use. You will be supported to achieve whatever you want to achieve. So please just come and get support when you can.
Brilliant. Thanks so much, Kat. Thank you.
Thank you very much. Cheers.